Hey guys, it's Dr. Tom Chaney from Living Health Integrative Medicine in Annapolis. In today's video, I want to answer the question, are corticosteroids beneficial for arthritis? So in our practice, we see a lot of patients that come in with pain, whether it's hip pain, knee pain, shoulder pain, all types of joint pain, back pain. And we see that many of these patients, before they get into our practice, they've had cortisone injections. You know, I just sat with a patient just recently this week, and they had just had cortisone 2 weeks ago. But guess what? They're in my office because they're still having pain. Now, we know, it's very well known, that usually cortisone will take care of the pain. But here's what is not always told to the patient. Some of the risks with that, right? So maybe it takes care of the pain, but we're not really told the whole story. And the whole story is that cortisone injection actually is doing nothing to actually repair the joint or repair the damage, which is actually causing the pain. Not only that, it gets even worse, and there's a study that I want to go over with you, and this is actually the title of this story, is a warning from a doctor who has done thousands of steroid injections for arthritis. So this doctor has done thousands of injections, but he's giving a warning. He's actually changed his whole opinion when giving corticosteroids injections into the joint for pain. And this actually, his opinion changed when he did an injection on a young mother. She had just given birth and she had hip pain. They injected the hip with cortisone, trying to give her some relief. She was in excruciating pain. It gave her some relief. She came back 6 months later and they did an x-ray of that hip. And they looked at the hip, the femur hip, so that's the hip bone, was completely gone. So she had rapid degeneration and decay of the hip bone. That's the ball and socket. It was gone. So this was super surprising to him. So they started doing research on this and looking into it further. And what they came back and showed was that many patients were experiencing symptoms that were worse than when they had the actual injection. So not all of them had the rapid decay or degeneration, but some of them had slower, more gradual decay and degeneration. They showed a large percentage of them actually showed more degeneration after. Because once again, we're not doing anything to rebuild the joint with the cortisone. It may take away the pain temporarily, but here's what can happen. If you take away the pain and you don't feel it, you're probably going to do some things that you shouldn't do, right? You might be a little more active than you should. It's going to put more wear and tear. But we know as well that the cortisone itself actually affects blood supply. It has been shown to affect blood supply, which is going to affect the health of the tissues, whatever tissues have been damaged. Now, what we do in our practice is we take a different approach. We don't use cortisone for these patients that come in with pain. We actually use regenerative medicine. We use natural substances to help to rebuild the damaged cartilage, meniscus, ligaments, tendons, whatever's been damaged. We actually inject that into the site to help the body actually heal itself and repair itself. Kind of hone in on certain growth substances and growth factors that help grow and heal that joint. It doesn't happen overnight. A lot of people like the cortisone because it's an immediate fix for a lot of patients. It gives you immediate relief. Now, regenerative medicine is more of a long-term solution, right? So we have seen patients that turn the corner very quickly and we're out of pain in just weeks, but a lot of times it does take time. It's not going to be something that is going to take away the pain like cortisone. It's a different philosophy. We want to help the body repair, rebuild, and actually regenerate the cartilage, because in the long run that's going to help you so that you don't have to face that joint replacement. You know, joint replacements are very common, but they all have risk factors, right? So we want to reduce all those risk factors. If we don't need to have that replacement, then why risk it? So I hope you got some great information about this. If you have any questions about arthritis, about regenerative medicine, it's a pretty new topic, and I could stand here and talk about it for many more minutes. But if you have any specific questions about regenerative medicine or cortisone or arthritis, then go ahead and leave them down below. I'd be happy to answer them, and I'll see you in the next video.